Well, good morning, everyone. Hope everyone is safe and well. I'm pleased to be here today to deliver the 2020-21 third quarter finances. Before entering public service, I spent many years working in the private sector, and I understand how important it is for the government to provide regular, transparent updates on the state of our finances. This hasn't always happened in Ontario, but our government is committed to accountability. After all, this is not the government's money, it's your money. And in a time of uncertainty, especially in a time of uncertainty, it's important we are clear about our plans. And Premier Doug Ford has been crystal clear. Our number one priority remains defeating this virus. Every decision we have made since spring has been made with the heavy knowledge that lives are on the line. It's why we are spending $25 billion more this year than we did last year. It's why our government outlined our $45 billion action plan in response to COVID-19 in the fall budget. And it's why since then we have been singularly focused on beating this second wave. And a lot has happened since our November 5th budget. Record high case counts, a province-wide shutdown, and a second state of emergency. And I know the public sacrifices and healthcare measures necessary to keep each other safe through COVID-19 have taken a toll on people. They've taken a toll on families. They've taken a toll on workers, on our employers, and on our communities. Many have paid a steep price. Je sais que les mesures de santé publique et les sacrifices nécessaires pour assurer notre sécurité mutuelle durant la pandémie de COVID-19 pèsent lourd sur les gens, les familles, les travailleurs, les employeurs, et sur notre communauté. And our government has been there to support those who have sacrificed so much. But as I've always said, you can't have a healthy economy without healthy people. And so it's important that everyone do their part. Our government will continue to do ours. We are unwavering in our commitment to doing whatever it takes to protect people's lives and livelihoods in this battle against COVID-19. Today's report on our spending during the third quarter demonstrates that. Over the course of the year, we have built in the fiscal flexibility to respond to unforeseen challenges. And because of that, we have been able to continue to make critical investments in healthcare, public services, all for the people of Ontario. And this report shows our responsible, forward-thinking planning has allowed us to continue to respond to this unprecedented situation. The report shows that the government has flowed all of the time-limited and extraordinary contingencies we had allocated for this fiscal year so that we could remain responsive as the pandemic continued to unfold. Now, some have criticized our plan. They've claimed that we haven't spent the money. These claims are simply incorrect. Thank goodness we were prepared. As I said before, just consider all that has happened since November, our November budget. Because we were prepared, we could increase capacity in our hospitals and protect our loved ones to the best of our ability in long-term care. Purchase additional supplies and equipment for hospitals for COVID-19 testing, including swabs, saliva tubes, and test kits. We could buy more PPE and critical supplies. And as we started to receive shipments from our federal partners, we were ready for the vaccine rollout. We have also been able to invest $1.4 billion to launch the new Ontario Small Business Support Grant Program to help small businesses that have had to sacrifice so much in their collective efforts to control the virus. Eligible small business owners who needed to close or significantly restrict their services during the province-wide shutdown will receive at least $10,000 through this program and up to $20,000. More than 80,000 small businesses have applied for the grant to date, and many have told us it has made the difference between keeping the lights on and turning them off for good. And I can't help but take this opportunity to plug the application portal. If you're listening and you own a small business, please find out if you're eligible by visiting ontario.ca/COVID support. Now, we will continue to be transparent. We will continue to be accountable. We will continue to act responsibility. And we will continue to spend whatever it takes to protect our citizens and defeat COVID-19. That's why today I'm announcing an additional $2.1 billion in funding, which has been made available for our COVID-19 response. In technical, financial terms, we are making this funding available by drawing on the fiscal reserve to top up our contingency funding. This is an extraordinary step, but these are extraordinary times. And we have to be prepared to do whatever it takes to protect the people of Ontario. All of us know this level of spending is not sustainable in the long term, but defeating this virus together, that is what's most important right now. Defeating this virus is what will allow us to embark on a strong, long-term economic and fiscal recovery for all of Ontario. Stopping the spread of COVID-19 is not only necessary to protect our health, it is also the most sensible economic policy. We will keep doing whatever it takes to protect the people of Ontario, using all our fiscal firepower to take us through this unprecedented crisis. So thank you again to everyone doing their part to protect each other's lives. Nous continuerons de faire tout ce qu'il faut pour protéger la population de l'Ontario, en ayant recours à notre pouvoir financier pour nous sortir de cette crise sans précédent. Je remercie donc de nouveau toutes les personnes qui prennent les mesures nécessaires pour protéger leur vie et celle des autres. We will get out of this together. We will emerge from this stronger. And I will provide an update on our plan to do exactly that in the 2021 budget next month. Thank you, and I'd be happy to take some questions.
We'll go to the phone line now for questions. Just a reminder, it'll be one question, one follow-up.
Ladies and gentlemen, as a reminder, should you have any questions, please press star 1. Your first question comes from Ashley Legasic with News Talk 1010. Please go ahead.
Hi, good morning. Thanks very much for taking my question. I had a question about the contingency fund, the $13.3 billion. Minister Bethlenfalvy, can you explain exactly what took up the biggest chunk of that money? Where did the most money go to in terms of spending that?
Well, thank you for the question. Well, throughout the year, I can tell you the biggest chunk of that funding has been in our healthcare area. And thank you again for highlighting that we did set aside $13.3 billion as contingency, emergency contingency funding, as well as time-limited one-time funding to guard against the uncertainties of COVID-19. So, Ashley, a big chunk of that went to healthcare. As we've said in our third quarter, we increased hospital funding by another $869 million, bringing the total incremental funding for hospitals to $3.4 billion. That's above what we had planned to spend when we started the year. Our long-term care is another area where we put significant funding in. Again, the total being so far an incremental $1.38 billion from what we intended to spend. We put in another $1.4 billion, as I just mentioned, for the Ontario Small Business Grants Program to help those small businesses who've really suffered through this period. I really understand in my community, in Pickering and in Uxbridge, so many businesses have been suffering. And, they're not only the backbone of our economy, but they're the identity often of our communities. So much of the small business of Ontario is the heart of our economy. And as I said, we can't have a healthy economy without healthy people. So most of the funding has gone into healthcare, but we're also helping businesses and livelihoods as we work together to get through this pandemic.
Follow up, Ashley?
Thanks very much. And my other question is about social services. So I could be wrong, please correct me if I am, but I understand there's about $400 million less being spent on social services. Can you explain why and where those cuts are exactly happening?
Well, thank you again for that question, and let me be crystal clear on that, we've the supports for our social services continue to be fully in force and will continue to be there to help our most vulnerable in society. And let's also be clear that the increase in spending in social services is over $500 million compared to last year. Why is it slightly lower from what we said it would be in November to now? A big part of that is the unprecedented support from the federal government in terms of income supports, and that's fundamentally their role in the stabilizers of employment insurance, and they launched the Canada Emergency Revenue Benefit, the CERB, through the pandemic, which is now transitioned into the Canada Recovery Benefit, which is also helping the most needy in society who are on social services or need income support. We also have continued to provide funding for the most needy. I would point to the Social Services Relief Fund, administered through the Ministry of Municipal Affairs and Housing to our municipalities to provide over $500 million of support to help the most vulnerable in their communities. So there's a lot being done. Those supports remain in place. And again, I just mentioned the federal government, I mentioned the provincial government, I mentioned municipal governments, and together we are providing unprecedented support for the most vulnerable in society.
Next question.
Your next question comes from Robert Benzie with the Toronto Star. Please go ahead.
Hi, Minister. I wanted to ask you about paid sick leave because it seems to me that you have the fiscal flexibility to afford a paid sick leave program. So the reason you're not doing it isn't because you can't afford it. Is that right?
Well, thanks for the question, Rob. As part of the Safe Restart program negotiations, as you know, Premier Doug Ford championed support for the provinces, and we negotiated a $19 billion relief package from the federal government for all provinces and territories across Canada. Of that, we negotiated over $1 billion of a support program for 10 paid sick days in Ontario, so over $1 billion. And I know that the Premier has discussed that with the Prime Minister. I have with Chrystia Freeland and Monty McDonald, our Minister of Labour, with Carla Qualtrough, that program, which is over $1 billion, is there for our most needy who are requiring to be tested to be able to access. So to be clear, that's 10 paid sick days, and we want to incent people to get tested. And so this program, and we've talked to the federal government to make the awareness go up, because there's much funding available. So it isn't a question of money, to make it simpler and to make it faster. And I know together with the federal government, we're working on that. But going beyond that, Rob, we also want to incent people not only to get tested, to be able to have the income supports if they test positive, but we've created isolation centers right across the hot zones, including my region in Durham. In Oshawa, we repurposed a Holiday Inn as an isolation center so that if you are unable to isolate, we'll put you up in one of these isolation centers, not at your cost, along with the sick paid benefits, and until you can quarantine for the 14 days.
Follow up, Rob?
Yeah, Minister, the other thing I wanted to ask you, I mean, we see that spending is now a record $189.6 billion, which is $2.6 billion more than your predecessor had projected on November 5th. So that's, only a few months ago, and it's changed a lot. I'm wondering, as you look ahead to next month's budget, you've got a revenue problem. Is it time to start thinking about raising taxes, whether it's on income or on sales taxes, these kinds of things, that just because you have a revenue problem and you're going to have to do something down the road? You're either going to have to cut spending or increase revenues.
I'll answer it two ways, and thanks again for the question, Rob. Number one, our singular focus right now is protecting people's lives and their livelihoods, making sure that we can get through this difficult period to when we get vaccinations into arms, and we're not going to relent on that singular focus. With regard to the future, there'll be a time and place. These deficits are not sustainable. As I mentioned, they're not sustainable in the long run. But I'm a big believer in the people of Ontario. I'm a big believer in the entrepreneurial spirit, the innovation of this province, our academic system, and I think we have the opportunity to come back and come out stronger from an economic point of view. And so we'll continue to look at ways to put in the conditions for Ontario to lead the country again as it was before the pandemic in terms of job creation and the jobs of tomorrow, and go to where the puck is. And I really believe in the resilience of the people of Ontario, the ingenuity of the people of Ontario, and I think we've got an opportunity to grow this economy and we'll come out stronger.
Next question, please.
Your next question comes from Mike Crawley with CBC News. Please go ahead.
Hi, Minister Bethlenfalvy. In your statement, you said that the money that was in the contingency funds has all been spent, but in the COVID contingency funds has all been spent. But the financial documents show that it's either spent or allocated. So can you clarify, roughly speaking, how much of that $13 billion in COVID targeted relief has actually been spent already?
Well, I guess in technical terms, and you just had a technical briefing from the Deputy Minister, it's been allocated. The way I'd like to think about it, Mike, is that, when you start the year, you plan to spend, as Rob Benzie just said, we plan to spend, I think it was $152 billion. You don't spend that all on day one, but you've got commitments that you have to pay, and you continue to pay them throughout the year. What we did this year is we set aside a bunch of contingencies to say, well, as we got into the pandemic back in March, we tabled a $30 billion support program, of which $15 billion was set aside for health. We upped it to $45 billion. So the prudent thing to do is to say, okay, we're going to spend on this, but we're also going to set aside some money over here because we're not sure exactly what tomorrow is going to bring. Case in point is the $1.4 billion that we now have allocated to the Small Business Grants Program. So we know we're going to spend that money. So $13.3 billion has been allocated. But in addition to that, what we're saying is we're setting aside some more money. We're drawing down the reserve so that in the fourth quarter, and just to be clear, that's from January 1st to March 31st, so we're right in the middle of it, for any other expenses that are unforeseen. I think it's very wise and prudent to set aside that money. We've demonstrated it every quarter that we set aside some of that and we spend it or we allocate it. So it's gone. We can't spend it again. We didn't have a lockdown before December 26th and the state of emergency orders. We didn't have the volume of the so-called variants of concern, the mutations that are occurring in the virus. We've put money aside for the vaccination rollout. And while the supplies have dwindled over the near term, over the longer term, they're going to ramp up again. So we're going to have money set aside for that. So what I can tell you, Mike, is that if you look at what Rob Benzie just said, $152 billion last year, we increased spending by $25 billion, and we're using up the contingencies. We're using up the one-time limited funds because, as the Premier said, and has said repeatedly and clearly, we're not going to spare any expense protecting the people of Ontario and their livelihoods.
Paul, what?
So how confident are you that by the end of the fiscal year, all of that billions in COVID funds will actually have been spent on programs to help with the province's COVID response? Yeah,
it's a good question. I guess I don't have a perfect crystal ball. No one knows for sure what's around the corner. But I can tell you again, it's really prudent to have that money set aside. And if the past is any evidence of the future, we're allocating all the funds. because we'll continue to invest in our healthcare system. We'll continue to support our most vulnerable. We'll continue to support our small businesses. So we didn't have that program. When we did the budget in November, we didn't think that we'd have a lockdown in the province-wide at the end of December. So we pulled out the Ontario Small Business Grant Program for $1.4 billion. So I think if past is any indication, Mike, I think that we'll be using the funds as we see fit, given the exigencies, the uncertainties that are around the corner.
Next question, please.
Your next question comes from Jeff Gray with the Globe and Mail. Please go ahead.
Oh, hi, thanks. Hi, Minister. Just to pick up on some of that, in your opening remarks, you mentioned how the people who'd said you were sitting on money or not spending money were incorrect. And that we can agree on. I think there was a lot of rhetoric around this stuff. But there is the central point that was made by the FAO, which was that at September 30th, there was $12 billion sitting unspent. Was there a problem there then with the speed? Do you have a problem with the speed of getting money out the door? There are a lot of things that people thought September 30th the government should have already spent money on: long-term care, schools, etc. Is there an issue with getting this money out the door?
Well, first off, thanks for the question, Jeff, and thank you to the Financial Accountability Office and Peter Weltman and his team, who really they're also doing important work. And you know, as I said in my remarks, I come from the private sector, and I really believe in transparency and accountability, and so other eyes looking at the books. The fact of the matter is, at the time, based on the numbers that we said, 80% of that $12 billion had been allocated, and of course that comes up all the time. You know, in terms of did you spend all the contingencies? And the facts are, yes, we have in the one-time expenditures. And again, that was done in the budget in November. I'm here again to tell you today that that money has been allocated, it's being spent, and that's $13.3 billion. What I'm also here to tell the people of Ontario is that we've drawn down the reserve and we've added to the contingency for what we're going to spend, because, you know, we have to respond. We didn't, as I just said, we didn't have the lockdown. We didn't have the state of emergency when we gave the last update. So we didn't have the variants of concern, the mutations occurring. I really believe you can't have a healthy economy without healthy people, and we'll continue to make the investments, Jeff, as the facts demonstrate right here.
Follow-up question, Jeff?
And just probably some clarity there. I think Mike was asking about whether you anticipate spending all the 13.3 that's allocated. But I wanted to see if you could answer that. And then, do you expect to spend the 4 as well before March 31st?
Well, I think I'm being pretty clear that the $13.3 billion has been spent or allocated, all those funds. So they're spoken for. What we're saying is that. You know, I think Mike's question was, what's the chance you're going to spend the additional money you've set aside? And I say probably pretty good.
And for a final question?
Your final question comes from Colin DeMello with CTV News. Please go ahead.
Hi, good morning, Minister. I just wanted to return to the $427 million in the social assistance spending that is lower than projected. Can you tell us, so if you don't spend that money, where specifically is that money going to go? Is it just going to go to pay down the deficit, or is it going to be allocated somewhere else, or is it going to be held over for social assistance spending in the future?
Well, thanks, Colin. And to be clear, as I said in my response to that question at the beginning, all the supports remain in place for the social services. The expenditures are planned to be up over $500 million over last year, so money is going out the door. As you can imagine, when you're spending $25 billion more than the previous year, the money is being spent on a priority basis to help the most vulnerable. I mentioned the Social Services Relief Fund of over $500 million. We provided $2 billion in total to the municipalities, $2 billion for transit, for the shortfalls in municipalities on transit. We've provided funding now for the small business grants. So, you know, the expenditures and the supports will continue to be there. They're significant. As we've highlighted in the report, $2.6 billion more than what we said in November. and we've set aside even more money by drawing down the reserve in part to make sure that we continue to have the money available to support the most vulnerable in society, those small businesses that are suffering, our healthcare workers, our frontline workers, our infrastructure. We're going to continue to make those investments.
And follow-up.
Thank you. I'm sorry, that doesn't quite answer the question of where that $427 million goes. And just to follow up as well on another topic, from a financial perspective, how is this province preparing for a potential third wave of COVID-19?
Well, as we've highlighted, where we have a plan to reopen the economy, but the first priority to make sure it's done safely. The Premier has been very clear, and I think the Minister of Health have been very clear as well, that should the third wave become apparent, we'll take the steps necessary based on the guidance and the best advice from our health experts. But the prudent thing to do right now is to safely reopen our schools, to safely, in the regions, starting with the ones that have been mentioned, in the green zones this week, and beyond next week and the week after, to do it safely. But we won't hesitate to take measures as appropriate to continue to keep the people safe. So the third wave, who knows what's around the corner, Jeff? It's encouraging to see the numbers come down, but we have to rely on the individual responsibility of all Ontarians. At the end of the day, by staying at home, staying safe, following the protocols, and really, it's going to take almost all the almost 15 million people we have in this province to work together to combat the third wave. And I would just say, finally, as the vaccines come in, General Rick Hillier and our chairs of our task force, our vaccination task force, Sylvia Jones and Christine Elliott, we're ready to continue the vaccinations, and that's the biggest, I guess, defense against the third wave, along with the measures that I just mentioned. So thank you very much.
Thank you.
Thanks, everyone, and have a great day, and stay safe. Test negative and stay positive.